Hello, everyone, and welcome to another episode of Understanding CBD. My name is Stephen Wallman, the owner of Wallman's Apothecary. We do really high-end, high-quality tinctures. These are a few of our bottles. We have it very professionally labeled, full cannabinoid terpene profile on the back, as well as a QR code. I had 3 bottles because we do a raw or CBDA, a cooked, and then one in the middle. Enough about me. I want to talk about our fantastic guest today. We have Colleen Higgins. I'm going to introduce you to her in a minute. And she is going to talk to us about dosing and the entourage effect and the importance of really finding your sweet spot. And, for me as a cannabis or CBD company, it's very common where someone calls and says, which one's for sleep, which one's for pain, and which one's for anxiety. And it's a conversation about, there's so many different types of varieties, but it's really a discussion of helping them understand how to select the right product and then how to find the right dose. So fortunately, we have an expert here today. I'm going to introduce you to Colleen Higgins. Colleen is not only a pharmacist, but she's an author, a speaker who helps translate the complex world of pharmaceuticals and cannabis medicine into an accessible language for patients and caregivers. She's also the owner of Dispensary Teams, and that's a company that does training for both dispensary employees as well as medical professionals and helping them to better understand the dispensary products and how to translate that into patient care. Welcome to the show, Colleen.
Thanks so much for having me, Stephen. Happy to be here.
Yeah, I'm glad to have you here on this beautiful afternoon with no rain here on the East Coast.
Oh, for once.
Well, I'm really glad you could join us today because, as I was just really mentioning, it's a huge gap between an understanding of cannabis in general. Most people think it's just to get high, and they think cannabis as medicine comes with a wink, wink. Like, yeah, people are just saying that so they can get high. But then there is a reality, right, which is, cannabis has been used for medicinal purposes for many, many years. And the medical system is really behind the times in advising patients. So we have pioneers like yourself that has, clinical experience that's out here taking a leadership role and training people to catch up so people can understand and really get the benefits of this. Before I get into really all the deep questions, as a pharmacist, when did you or how did you open up to cannabis as medicine and not keep that blinders on like most people?
Sure. I would say when medical cannabis I live in Connecticut. So we had the medical cannabis program come to Connecticut in 2014. And I looked over the legislation of how it was going to be run, and it was going to be dispensed by pharmacists. And I thought that was fantastic. So I attempted to get a license here in Connecticut. We weren't successful on the first round. So I did start working within the dispensary. And right away, I caught on to the lack of knowledge. Patients would sit down in front of me and say, I have cancer or I have Parkinson's, go. And I'm just like, ooh, I really did not have any idea of how to help these patients, especially with the products on hand. So I was just driven to really understand it. When I find something interested and when I find a hole within the healthcare system, I'm really driven to help patients understand the products and find success with their symptoms and to really understand what's going on. Cannabis is everywhere. People are using it everywhere. So I was a cannabis user. I don't use too much today, but I was a cannabis user for sleep and relaxation. And so I just thought this is going to be really fantastic as a tool in the tool belt for people who may not be successful with other pharma medications. And so for me, it's just a matter of understanding the delivery systems, the dosages, and then how to help patients with the cannabis products that were available.
That's awesome. And we're going to dig into that today. And one of the things that comes up very frequently is someone would recommend a patient of theirs to try cannabis. And the first thing that people bring to me is, look, I don't want to get high. I don't want to get stoned. So people are looking at the intoxication that comes with cannabis as a negative side effect of anything, which is why a lot of people come to CBD. When you use THC and you get high, it's instant, right? You feel it. Oh, this is the euphoria that I'm getting. This is the medicine, as people think. But when it comes to CBD, And dosing, it's not an instant feeling. So can you explain the concept of CBD dosing and why it's important for patients, people to find the right dose?
Sure. With any medication, it's always going to be crucial to find the right dose of medication for a myriad of reasons. There's a bunch of reasons, but if you think about, I like to compare CBD. I mean, CBD is touted to do just about everything under the planet, right? So it can save you from depression. And actually, it does have it does have studies that show it can actually affect depression markers within the body. So that is true. But it can help you for sleep. It can help your belly. It can help this. It's people will get confused thinking CBD can do just about everything. But I like to focus on first just a kind of simple. That's what we do at Dispensary Teams, is kind of make it very, very simple. And then you dive into the nuance of the drug as well. But initially, if you look at CBD, it's just a very potent anti-inflammatory. And we have such systemic inflammation in our body these days that it causes, it's actually linked to so many systemic issues and so many chronic diseases, autoimmune diseases, dementia, Parkinson's, or just kind of general pain as we age. So if we start with step number one and look at anti-inflammatory action, that doesn't happen immediately, right? If you take an anti-inflammatory, it can take some time to bring down that inflammation to help you feel better. So what you really want to do is you want to find the right dose. You want to take it at the right frequency, and you want to take it for a short period of time, kind of as a testing, kind of to see, is this going to be right for my body? If you take too little, which in my experience, when people have tried CBD, that's kind of the problem, is they take way too little. They don't understand how the product is labeled, and they take maybe a dropper full once a day, and they consider that, and then it's not really doing it. I thought it was doing something, but it really doesn't do anything. Well, what's a dropper full? A dropper full is not a measurable dose, and once a day is typically not enough if you're taking a CBD product. So it's at the beginning, it's about finding the right dose, the right frequency, which for my patients, I typically start with either 2 to 3 times a day. So that's every 12 or every 8 hours. Some people can't remember to take something 3 times a day. I get it. So morning and night, every 12 hours. If you take a proper dose and you start low and kind of increase, we'll go into the dosing a little bit more, then you're going to be able to kind of dial in your dose and not overshoot. When you overshoot with CBD or with any medication, you're then kind of leaning into side effects, which is what you want to avoid, and what will also usually stop you from using the drug eventually. If you're dealing with side effects all day, you're going to be like, it's not for me. I don't really want to use it. When really, maybe if you just lowered the dose a little bit, it could actually work really well for you.
So when you're starting, I think the first thing would be, what type of product are you going to choose? There's gummies, there's tinctures, you can smoke it, there's patches, topicals, all this other stuff. Can you give us an idea about how you would decide on which one would be a good place for you to start?
Sure. I would say there's the number one factor is going to be with CBD. If we're talking about CBD versus THC, and by the way, for people that are looking to use THC, if you do blend it with a lot of CBD, it can mellow out that psychoactivity, and it can still give you the pain relief or the relaxation without the strong high feeling.
Well, maybe you can start there then, because,
Sure.
I think most people don't have a preference. They're coming to us or you with a symptom or a problem, and they want it resolved. So THC, CBD, they don't really care. Do you have like, should you start with a blend of both, or what do you think?
If we're looking at, usually the place to start where I start is, what are the symptoms? Is it a acute symptom that comes on really quickly, like nausea or panic or something like that? If that's what the symptom is and that's what the issue is we're dealing with, typically they're not going to want to wait an hour for an edible to start working. Or do we have a chronic condition? Do we have pain? Do we have some sort of chronic symptoms that we're looking to relieve? In which case, an edible can be used and scheduled around the clock. So if you have something that goes on 24 hours a day and never goes away, probably an edible is going to be suitable. Although I do have Parkinson's patients where clearly they have symptoms all the time, but they prefer just to kind of puff on something and move it along. Maybe they'll take an edible twice a day, but if in the middle of the day when the edible maybe isn't as prevalent, they'll puff on something to get that quick relief. So when we talk about dosing, inhalation is going to be very fast and typically not last as long, about 1 to 3 hours. And then an edible is going to take about an hour for most people. I always tell people when they start taking edibles to document how long it takes to work for them. About an hour to start working, but then it works from about 4 to 6 hours. So you really have a difference in the timing, and that's going to depend on what kind of relief the person is looking for. If we're looking for THC, it's easy. You can feel it right away. With CBD, it might be a little tougher to feel if you're inhaling it. So oral dosing, I prefer oral dosing when using a CBD alone product because you're going to get more relief, longer relief, and it typically is better suited for what we're trying to treat with CBD products.
So when you say oral, you mean like a capsule or
whatever they prefer. I mean, we have gummies. A lot of people don't want gummies. They just don't like them. So you have tinctures, you have capsules and tablets. So you have liquids, capsules, and tablets, and probably gummies are the easiest way to go. You can add things to your drink. Anything that's added to a drink or anything that's in a drink, I think it's important for people to know that's a different technology. So a normal edible, a cookie, a gummy, something like that, that's going to take about an hour to start working. And then again, last about 4 to 6 hours. If you have something in a drink, it's called nanotechnology. And what nanotechnology does is it takes that non-water soluble oil molecule and it makes it more water friendly and it works quicker. So anything that's a drink with CBD is typically going to kick in at about 15 to 20 minutes and may last for a shorter amount of time, maybe 3 to 4 hours. I do know people that don't prefer the nanotechnology because the part of the molecule that makes it water friendly, the surfactant, that can cause people to have headaches. And if they already deal with headaches, it can make them worse. So I find people with the drinks, they might like them here and there, but on a regular basis, they typically don't prefer them as much.
Okay.
If that makes sense.
Yeah, that's helpful. Now, when you're titrating in your dose, a lot of people are concerned about side effects. What are some things to look for during that process, and how long does it take to figure this out?
So in terms of starting, let's say with an edible, because or an oral dose or a tincture, remember it's going to take about an hour to start working. So you want to start low. And I've seen people have great success with a dose as low as 10 milligrams. Some people will start at 5 milligrams of CBD. I find that's kind of a waste of time. 10 milligrams is a nice starting dose. I had one person who had an arthritis. She was dealing with a lot of arthritis. She took the dose, and within 20 minutes, a half hour, her rings started to fall off because the inflammation in her hand started to go down. So it can work for some people fairly quickly. And she was taking it 2-3 times a day, even 4 times a day when she was having those really, really bad days. So 10 milligrams is a nice starting dose. Again, every 8 to 12 hours to test it out. Let's see, is it working for me? And I would say for about 2 to 3 days. If it's doing absolutely nothing, let's say you're on day 2, you're feeling absolutely nothing, then you can go up on the dose. Typically up to 15 or even 20 milligrams. You can even double it. So let's say we went from 10 to 20. If at 20 milligrams, we're starting to feel a little bit and it's feeling good, we're taking it every 8 hours, but we wish we had a little bit more relief, you can go up to 25 milligrams. 25 milligrams is turning kind of into a standard dose of CBD today. I'm seeing it in a lot of products. I love it as a dose. Even if you wanted to start at 25 milligrams, it's a great starting dose. And then from there, you can increase the dose. I've seen people that were on steroids like prednisone, and they just did not want to take prednisone for a while because they were just sick of the side effects that can have some really brutal side effects. So they would take, in place of their 50 or 100 milligrams of prednisone, they would take 50 or 100 milligrams of CBD, and they found it worked really, really well. When we step up into the higher doses, let's say you were taking 25 milligrams 3 times a day, and you said, I'm going to double. I'm going to go to 50 milligrams 3 times a day, see if it's better. If you start developing a headache, just a mild, dull little headache that doesn't seem to go away, that's when you're starting to enter into a little bit of a higher dose than your body is really going to like. The other thing that I've seen as well in terms of a side effect that's really common is like a stomach upset or cramping. CBD can decrease the appetite. Good news. So that's not a bad thing for a lot of people. But for people dealing with cancer, that might not be such a great thing. So you want to make sure that if you're getting into that area where it's decreasing the appetite, and rather than increasing the appetite, then that's another sign to kind of decrease that dose. It's a little too much for the body to handle. If we're going to talk about the prescription Epidiolex, the doses of that go up to over 1,000 sometimes based on the weight. It's based on the weight, and that's used for seizures, for kind of very hard to treat seizure disorders. So those doses get very, very high. And typically people that are dealing with seizures, they have to deal with side effects from the medications anyways. But as someone who's looking to just treat kind of their symptoms and their moderate pain, you'd like to really taper that dose to where it's comfortable and you're not dealing with those side effects.
Okay, well, that's good that we have some clues now to look for when you know you're getting on the top end of that to get relief. But then again, there is a level, and it helps to know what to look for.
Yeah.
How does my head,
Stomach upset. Those are the two that kind of kick in.
Now, the method of administration, whether it's sublingual or ingesting it, do you see any relationship between the numbers of milligrams? Like if you're using a sublingual 10 milligram, would you eat the same? Would you ingest the same amount of 10 milligrams? Because I've heard of this bioavailability, discussion. So how do you kind of relate to that?
When we inhale, it goes directly into the bloodstream, so you need less to get the same effect. It's the same thing with sublingual. When you put it under the tongue, it goes directly into the bloodstream, and you're not getting metabolized through the liver. Think about nitroglycerin. If somebody has chest pain, they put it under the tongue, it gets absorbed very, very quickly, starts working very, very quickly. Oral dosing, you got to travel. You got to move along. So you take that dose, it goes into the belly, you got to get it into the intestines, you got to get it absorbed, you got to go through the liver. That's going to take time. And once you're in the liver, it breaks down, and it breaks down a lot. And so you have much less that's available within the bloodstream than when you take it sublingually. So if you were to take a 10 milligram dose of CBD, I would recommend sublingually cutting it down to 5.
Got it. Okay. Yeah. So about half.
About half.
Take. Okay.
Yeah. And again, they could play with that dose and see where it's at.
Okay. That's really good to know. Now you mentioned Epidiolex, which is the FDA approved CBD. What's the difference between what the FDA has approved CBD and what we would have here, which is a full spectrum we call CBD with all the other natural, flavonoids, cannabinoids, terpenes that are in the plant, not just an isolate CBD.
Sure, like a broad spectrum. Yeah. So basically, when you have a pharmaceutical drug, here's the difference. Here's like the main difference in pharmaceuticals and everything else. Every time you get that drug, it's exactly the same. It's like a fingerprint. Every time is exactly the same. So when you're treating something like seizures, and there was in my book, The Cannabis Prescription, I did mention Dr. Bonnie Goldstein, who is really a pioneer in this industry. She's a doctor dealing with seizure patients. And she wrote a study about what tincture ratios were working best for her patients. And the ones that were not working as well had variability in the terpenes. The terpenes do affect a lot of that seizure activity. And it's not the same every time we produce it, because the plant is not the same every time we grow it. Every time we grow it, it's different. And if you extract that oil out, it's going to be different each and every time. And in a pharmaceutical model, you want it to be identical every single time. So every batch of that Epidiolex is identical to the next. And that gives you that predictability that you have in pharmaceutical medicine. So it's not a bad thing. It's just expensive.
Yeah, I can tell. So as far as the efficacy or dosing, if you're using a single molecule, just CBD, or if you're using a product that has terpenes, but even other cannabinoids like the minor cannabinoids, CBC, CBG, CBN, people talk about all the time. What's the relationship between those, and do they play a role? Should you watch out for them? Is it something that you would want to experiment with? Do you have any?
They benefit. I mean, when we're talking about seizures, that's a whole other ball of wax, and that's a specialty, and that's something that needs to be pharmaceutically driven. But when we're talking about general pain, when we're talking about inflammation, the plant in itself is anti-inflammatory. Every one of those molecules is anti-inflammatory. And the entourage effect is a great benefit of the plant, where you get the whole sum of the molecules is better than each part. CBG, we're finding fantastic anti-inflammatory action for the brain. So think dementia, think Parkinson's, really good stuff going on there. CBN, I'm a huge fan of CBN as well. We're seeing it a lot of products because it's relaxing. CBN is formed when THC, the psychomolecule THC, just naturally degrades over time. So some people think it can cause a high feeling. And with CBN, I've heard if you inhale it, there may be some kind of a high feeling with it. But typically with an edible, I'm not, excuse me, I'm not seeing that with patients. So CBN is relaxing, which is great for people that maybe need something that's not going to give a, excuse me, is not going to give a high feeling during the day. So you're having some anxiety, you really want to take something for it, you don't really have anything. A CBD plus CBN product is great for that. Also for sleep. If you're having an issues sleeping, and so many people do, CBN maybe at a little bit of a higher dose could be used for sleep. I know people that have used it for sleep, and it's very effective as well. So all the other molecules that we have going on in the plant, I think are fantastic and can only benefit people.
Do you recommend using it, like you mentioned, CBD plus CBN? Do you recommend using any of the other minor cannabinoids more as a sidecar, or do you see it as a replacement?
I think the more you can get in there, the better, because they have so much great anti-inflammatory action together. So I think if you can get CBG and CBC in everything, why not? Why not take the benefit? It's not going to add anything to the experience in terms of psychoactivity. The experience a lot of times is driven by the terpene profile and other medications that are added in. I've seen some CBD products that will add in things like lemon balm for relaxation, or valerian root and passion flower for sleep, or linalool, right? Linalool is a well-known terpene within cannabis. Linalool is in lavender. When we think of lavender, it's relaxing, sleepy, all that kind of stuff. Those are all going to benefit that sleep person who's I'm a sleep person who's trouble sleeping. So you want to look for all those other little elements, and those coming together can hopefully create a really nice sleep product for somebody that has difficulty either falling or staying asleep.
Yeah, I'm glad you brought up sleep, because that is one of the biggest challenges that people have. So mentioning, how you can use it for helping sleep is really helpful, and mentioning that adding CBN also is a good trick that I've heard a lot of people recommend as well.
I would say in dispensary settings, sleep is number 2 after pain, for sure. I would ask everybody, do you have trouble sleeping? And if so, do you have trouble falling or staying asleep? And typically it was both. So many people have trouble sleeping through the night these days. So it's a big problem, especially as we age.
Yep, that's true. That's true. And there's a lot of cool things you can do with CBD and without CBD, getting in tune with your circadian rhythm and following the sunlight if you can, if you don't have a job that keeps you up all night.
Exactly. Maybe a little scotch of melatonin. Melatonin these days, people are typically taking too much. It should be about 1 milligram, a very small amount of melatonin. You see doses of 5 and 10 milligram. It's supposed to set your circadian rhythm, not slam it with a truck. So you just want a very little bit. And that's kind of the way that cannabis works within our endocannabinoid system. We're looking to accentuate the endocannabinoid receptor system. We're not looking to overwhelm it.
Now, no one, I'm glad you brought that up too, because, people do talk a lot about melatonin, and they're using other sleep aids or pharmaceuticals for dealing with their conditions that they've been prescribed. Mm-hmm. How do you see or caution or advise patients that are already on medications and how to incorporate CBD or cannabis in general into their regimen, and how do they get started?
I would say it's never a bad idea to speak to your physician, especially if you're on cardiac drugs, blood thinners, things like that. Also psychiatric drugs as well. CBD is generally very well tolerated, but it's never a bad idea to have your doctor in the loop for sure. You can also, one of my favorite websites, and they helped me tremendously when I first started out in the industry, because I had so many questions. I didn't, we're just learning. We're just learning. And so it's called The Realm of Caring. And they are in Colorado. They are a nonprofit. They hold monthly meetings with providers, healthcare providers, to get feedback on what's going on. They have a fantastic site of drug interactions. So if you're looking for the latest drug interactions, that's the site to go to. The Realm of Caring in Colorado. If you just Google it, I think they changed their website address to, it used to be therock.us. I think it's now the Realm of Caring, actually. And they really have the latest medical information on drug interactions. But I don't see it being a bad thing, especially for sleep, because a lot of times a little multi-cocktail can work better than one thing anyways. And a lot of people will start taking the Ambien or things like that, and they'll get used to it and it won't work as well. those drugs were really designed to be taken a few times a week, not every single night. But anybody that works in a pharmacy knows that people take them every single night. And at that point, you're really used to them and you have a dependency on them, and you would have to taper off of them to come off of them. So to add in CBD and CBN, I don't see it being an issue at all. I think it can only help with the whole sleep disorder that a lot of people seem to have.
Now, the conflict in the liver enzyme, I've heard before about certain medications that say don't take with grapefruit. Can you shed some light on that?
Sure. Grapefruit will speed up your enzymes. It'll speed up that metabolism. So if you put something into the liver, it normally, when it would just travel through on its own regular path, it will now zip through, and you'll have less of the drug in the bloodstream and it won't work as effectively. So for the drug I think of always is Lipitor. I actually called Pfizer way back then. And this is why things change all the time. I called Pfizer when Lipitor first came out, and they said, oh, you can have 1 glass of grapefruit juice a day and you should be fine. Now it's no grapefruit juice. So it's enough where it will speed up the metabolism of your medications to kind of zip them out. And it's not all medications. It's only the medications that are affected by these certain enzymes. Is CBD one of them? Honestly, I don't know. I haven't seen anything on the realm of caring about it. So that's a really good question, something to look at for sure.
Okay. So when you take medications, is it okay to take CBD at the same time, or should you take it?
Which medications? There's lots.
Yeah, I guess that is the point. But there are some that you should definitely take a look at this realm of caring and make sure that you don't have one of those. I mean, I know anti-inflammatories is a popular one. I mean, that for me personally, I was using meloxicam to reduce inflammation in joints. Yep. And I heard somewhere later that there is a conflict potentially with meloxicam and CBD.
I'm not a fan of meloxicam. Meloxicam can cause kidney failure. So it's not even affecting the liver; it's causing kidney failure. And it's been it's kind of getting more steam on that. There's a drug that was pulled off the shelf called Vioxx many years ago because of cardiac issues. So those are COX-2 inhibitors, and they seem like a really great idea and concept. But in practice, they're not so hot. So I would not take those meds, and I would go on CBD instead. CBD has a much better safety profile, and it could potentially even be more effective. So between using an edible, I use the word edible for gummy, tincture, whatever you like, but between using an edible and then a topical, I think it can be more effective than those drugs anyways. I'm not a big fan of the COX-2 inhibitors. Personally, I would not take them.
Would that be... Now, where does just over the counter Advil, Tylenol that most people really live on a lot of times? You know, I play golf, and in the morning, it's like they're handing out their Advil.
I know.
Candy before
I love Advil. I've lived on Advil. I'm an athlete. I have lived on Advil. But more and more studies are coming that if you take a lot on a daily basis throughout the day, even it can increase your stroke risk. It can increase your risk of heart attack. So I love an ibuprofen. I'm a huge fan. It works very, very well. But I try to keep it to less than twice a week, 2 to 3 times max if I really, really need it. I try to just keep hydrated instead. You know, a lot of times dehydration can be that simple reliever in there. Magnesium is something else that can help with a little pain relief as well. Turmeric as an anti-inflammatory, and then the CBD. If you can take CBD on a regular basis, a lot of times that can help with it as well. If you really need it, you know, you can take it. But again, we live on it every day, 2-3 times a day is not going to be ideal.
Well, I love that message, Colleen, because it's really, hey, let's use what is less harmful first. And then if we still need a little bit of extra for the breakthrough, then you have tools that you can use versus the opposite, which is
exactly.
the current paradigm.
And if you're dealing with pain every single day, you should look at that. Right? We should look at what that is and then really get effective treatment for it. Do we need PT? Do we need stretching? Do we need Epsom salt baths? Can we take CBD every day, a few times a day, and get something out of that? You know, we should really look at, we have this problem with medicine where we don't look at the cause. So if you're dealing with an autoimmune disease, do they look at what you're eating? I was somebody that was dealing with chronic sinus infections. I was getting rashes on my elbow. I was getting bald patches on the back of my head, and nobody really seemed to connect it until it came down to a dairy allergy, because it wasn't getting it wasn't getting the traditional of what people see in studies. Whenever doctors talk to me about their studies, it drives me a little crazy, because you need to look outside the box. Okay, there's a lot of people dealing with stuff outside the box. As soon as I stopped taking dairy, I stopped being sick. I was sick all the time. I had 2 very serious sinus surgeries. I was drinking whey protein to work out, and whey is a concentrated dairy form. So it's whey is dairy. I didn't piece it all together, and I finally figured it out. And now I don't get sick. My immune system is back to 100%. And it was the dairy which was really dampening my my immune system and making me sick all the time.
Well, thanks for sharing that story, because I know that's going to help certain people that are having certain things that are unexplained, if you will, and certain things that just aren't adding up. And looking at diet is important. And it could be some of these hidden things. You have to be open with, well, I didn't really think about my shake, the protein shake. It's a health drink. I didn't think that could be part of the problem. So I also want to talk about your company before we end this discussion, Dispensary Teams, because I really think you're doing some great stuff. Can you share with us a little bit about the passion behind the business and who you're really out there to serve?
Love to. So it started because I have worked in several dispensaries. We were not able to attain a medical license. We may go with a recreational license. My business partner is hell-bent on getting a license, and I love that. You go for it. But I was always working in the dispensaries, and I found the lack of training to be a real problem, not only for the patients, it was a detriment to the patients, but obviously for the pharmacists that were working there. We are highly trained medical professionals. If you throw us in something with no training, we're not going to be happy. We're going to be very uncomfortable. And typically we'll go back to the area where we feel very comfortable and safe and secure. And that's why a lot of the cannabis industry, the dispensaries have a huge employee turnover, because they're not training their employees. They're not setting them up for success. So originally I wrote the book for patients, the cannabis prescription. And it turned into something that became a training tool for people that were working in dispensaries. I had dispensary managers saying, hey, by the way, I use this to train my pharmacist. I've had that said to me several times. So the next step was then to create a training program, which I have done now. I have it on my website, which is elevatethecannabisexperience.com. You can go to Dispensary Teams. It'll bring you there as well. And so I'm also getting CE certification. Pharmacists, I was trying to put the program out without CE certification. And I didn't think, even when people would come to me with programs that didn't have CE certification, which is getting points towards your license every year, I wouldn't do them. I didn't have the time. So I'm getting CE certification. We're going to be CE certified through Michigan Pharmacist Association. And we're going to be able to get more healthcare professionals to understand it. I'm also working right now with Kansas and Kentucky. They just got their medical program approved. And so they're getting a lot of questions. Kansas is getting a lot of questions of, we need to understand this stuff. We're going to be dealing with patients. So I want to make sure that they have a way of training themselves and their staff to really help those patients succeed. Because when they do, it's amazing. In a dispensary, it's absolutely fantastic to see what kind of benefit these patients could get. As a pharmacist, you don't realize it when you're just handing out the pills and stuff. But when you're sitting down with patients in a dispensary and you're hearing about all the things that have failed, this is a really great opportunity to help them. It's a really great tool to have to help these patients. So to understand it, to be educated, that's what we like to be.
I love that. So how do people consume the training? Is it video, online? Is it any live? Is it reading? What's the...
Yes. So it's really based off of my book. I went through the same order of that I wrote my book, and I provided the training. It's video. It's on a platform called Thinkific. So it is completely secure. There's no kind of nobody be able to access any of your information or anything like that. And what you do is you go through the modules in order, and it's going to help you, for dispensary people, it's going to help them to completely understand how to interact with their patient without overwhelming them, because I overwhelmed a lot of patients. I talk fast. And when you have somebody that's sitting down in front of you who's never used cannabis before, and you have them for about maybe 45 minutes, where do you start that conversation? That's a big conversation where all the products, the terpenes, THC, CBD. So it's a matter of bringing all that information together in a really precise, really focused way, so you can deliver the information, you can understand the products, feel like a professional, and you have a win-win situation. It took me about 2 years to develop it, of sitting down with patient after patient after patient. And once I got to the point where I said, I'm just going to talk a lot right now. And when you have any questions, interrupt me. And then at the end of it, I would say, do you have any additional questions? And they said, you've answered every question we had. So I knew I had it at that point. And I want to deliver that to healthcare professionals who are going to be interacting with patients on a daily basis as well, and don't understand what's going on in a dispensary.
That's the best way to do it in the real world, not in a vacuum. So
Exactly.
that's doing great things. Where's the one
Patients are
place?
using them. Yeah, patients are using the products already. So
Yeah, exactly. It's time to catch up, right?
yeah,
Catch up
exactly.
in the industry. So where is the one location where you'd want to send people to? Is it dispensaryteams.com to get more information, or where do you really want to
Yeah,
have?
Dispensary Teams, that'll bring you to our URL. It's the name of the course is Elevate the Cannabis Experience. So we want to bring up and elevate the experience of cannabis for every patient and every consumer that goes into a dispensary. We want to make sure they are recommended to have the right products. They don't waste money. They don't waste time. They don't get too high. Because if somebody uses too much THC, chances are they're never going to go back to it. So we really want to make sure that people are educated and able to talk to those patients and really feel comfortable about that.
Fantastic. Well, thank you, Colleen, for not only joining us today, but for all the work that you're doing to help people include cannabis into their wellness plans and get off some of the harmful other pharmaceuticals that they're on.
Yeah,
So
there's
you very
some
much.
medications that they're just not working, in which case they need to go.
Yes. Well, thank you so much. And if you guys have any other information or need anything, feel free to reach out to Colleen. She has a wealth of information to help everyone out. And well, that's a wrap for today. Thank you again for watching. And we will see you on the next episode of Understanding